Hi. Tomorrow, July 6th, 2020, we will reach the grim milestone of 3 million cases of COVID-19 in the United States. We have over 132,000 deaths at this moment as of right now. We need to talk about this. This is Conversation in Progress, and I'm Ed Kaine. And what we're talking about today is just maybe we should wear a mask. Wearing a mask is not as big of a deal as the president or other people might suggest that it is. We're going to talk a little bit about the safety of these. I'll tell you a little personal story because I do work in healthcare. But what we're doing here right now is, this is simple. You put it around behind your ear. I happen to wear this for about 10 hours every working day while I'm working. I'm a therapist. I'm an occupational therapist and a registered functional therapist. I wear this thing all day. It's no problem. I actually have another one that my wife did make me that has a strap that goes over the top of my head and around my neck. So that's a lot better. I do prefer something that has a strap that goes across, but I've got a trick for you to show you. This is the regular mask, right? But something you can do really simply is add a little strap. This is the little strap that I have. You could use, I made this out of thermoplastic here, but this is a thing that allows me to do this. So I can still put this over my ears, but then this is going to go back over, and I'm going to clip this behind the ear so that I'm not going to be digging it into my head. This is just elastic strapping. Then I just take and pull this back like this. Now you can see what happens is that it's pulling it off my ear a little bit. And this is the tied side. It's actually just has a girth hitch over it, but then it just goes over my lovely hairline. So off the back here, you can see that line there, and then you can see that I just have that little piece of plastic there. But you could do that with a paper clip. So there you go. So that's a different way to do this if you're wearing these long term. A lot of people don't need them long term. I do not wear a mask inside my house. My family, we're all being very careful when we're out in public. We're not hugging our neighbors. We're not doing all that stuff. We will play, if we have a good social distance. We do have a basketball hoop out in front of the house, and we're playing at that. We're not wearing a mask necessarily. Unless somebody's around while we're doing that. Otherwise, it's just simple. Just wear a mask. Now, here's some of the things that you've been told by people who are trying to, make this difficult. That you're breathing your own CO2. Well, that's just completely incorrect. There is no chance that that you are holding CO2 in this. If you were breathing in a plastic bag, yes, you'd be breathing in that CO2. A paper bag even would increase the amount of CO2, but it would probably exchange some. The idea that you are not taking, there's no volume in here to hold the last exhalation of your air, so there's no chance that I'm breathing in any significant amount of CO2. Is it moist? Yeah, you could say that there's some moisture back there. If it's not clean, there are ways of just cleaning these straight up. You could use ethanol, alcohol, or isopropyl alcohol, but just make sure that it's completely evaporated, both of them, before you use it again. So otherwise you're huffing a bit of alcohol there. So basically you can use these very easily. They're very safe. In the hospital, we're using them all the time. No problems. Now, there is a difference between this one here, and I don't have an example for you, but an N95 mask, respirator, or a K95, something that makes a firm seal around your mouth. Now, a little personal story. Early in the days, I live in Connecticut. We were cross-trained so that we were able to help inside the hospital. And by a significant bit of unluck, I was coughed on directly underneath this face shield. So I had a N95 mask and a face shield, and just by bad luck, no intention in it, no one was trying to harm me or anything like that, but someone did cough right up in there. I was a little, upset by it. People should, if you have it, please don't cough on somebody. intentionally, accidentally. If you're going to be accidental about it, cough into your shirt, cough into your arm, into your elbow, please do something about that. But anyways, this happened. I did not contract COVID-19. I've been tested negative for it. I did not have any period since that time of illness. So, like I say, that was a very secure setup. That was a face shield plus N95 mask. So for most people, we don't need this. Now, early on, the CDC representative, they get a little bit of a bad rap because they told people that masks weren't necessary. They told people this partly because they were trying to get the stock for healthcare. They have still, this is July 5th today, July 5th, and we have not secured a way to consistently make masks. Someone mentioned that during the war effort, during World War II, we were putting out a plane every 4 days, or multiples per day. You know, at some point that had been ramped up to a high volume of planes, airplanes, not 3 pieces of fabric electro melted together and with a couple of strings on it. You know what I'm saying? This is not building airplanes. So the trouble is we're getting this inconsistent message. But what if it's this simple? What if it's as simple as just wear a mask? You're going to be protecting yourself, which has a value to yourself, even if you're young and healthy. Now remember, people who have high blood pressure, have asthma, have diabetes, maybe pre-existing conditions, obesity, elderly people. Many of the people that are dying of COVID-19 are elderly. So if you think about this, there is that death rate. So I said there are going to be 3 million cases in the United States, positive tests. Obviously, that means there's many more cases that have been tested, right? And people haven't been tested, it's higher. Over 132,000 deaths so far, and we are on an upswing. Unfortunately, this does not have to happen. Wash your hands. Don't touch your eyes with those washed hands anyway. Wear a mask. Do that. If you can't, if something that does help you not touch your eyes, wear some glasses if you're concerned about it. So wear some safety glasses or whatever. But pretty much, if you do this, if everybody did this, we could open our economy a lot faster. We could, all these things that people say they want to do, which are super important. But places that tested early, we need a massive number of tests. But that's not something you can do or I can do. I can't control the number of tests. We need to wear this. This is fairly easy. Either this or cloth covering, something to stop those droplets. There's a joke going around that if a pair of pants can't stop a fart, how can this stop coronavirus? Well, a pair of pants will stop some flying debris. Okay, if you're one of those charters out there, just know, wear some pants. That's the same thing with this. You've been in a conversation with a spitter, right? Say it, don't spray it. That's what you're stopping. Very simple. Every time someone's singing, out comes a forced exhalation, some air is coming out. There was recently a big, huge choir that performed for the Vice President, Mike Pence. Apparently, some people had tested positive before that choir event. During practices, they knew they were positive. This didn't get stopped. This is silly, folks. This is so simple. If it's just this, and you can protect yourself, you can protect your family, you can protect your elders, this would be a very big help. You're protecting other people. If they are wearing it, they're protecting you, which in turn protects the other people that you're going to interact with. It's very simple. You remember the old Pantene commercial? You tell 2 friends, and they tell 2 friends, and so on and so on. Next to everything, everybody's using Pantene. It's a lot more contagious than Pantene. COVID-19, very contagious, often hidden in a healthy population, but then once in a while, you get it, you bring it to someone who's important to you, and you don't do it. So wash your hands, wear a mask. If you are in a contact with someone who does have COVID-19, wear the N95 mask. But otherwise, this is if both of you are wearing this is gonna help both of you. So you're gonna prevent somewhat, maybe like a third of the spread of someone giving it to you who's not unmasked, it was positive for COVID. This is tricky because we're not going to do this research, but find that if N95 mask can significantly increase that. The other person wearing it, so two people wearing masks, it's going to be a lot better in up to 95%, maybe 98%. Some people have speculated that it's going to be very unlikely. Now, you're touching surfaces, touching your eyes, that's just another access for entry. But this is where it seems that people are doing it. This is how you can protect your family, protect your friends. All right, well, this is Ed Kaine, and this is a conversation in progress. So if you have some other ideas about this, you think that there's something more we should do, something less we should do, go ahead and put it down in the comments. If you like this video, give it a thumbs up, please. Please subscribe to this channel. We'll try to give you regular content on a regular basis. If you're having trouble having a discussion with a family member on this topic, maybe bring this up and see if you can extend that conversation even further. Thank you so much, and we'll talk to you soon.